committee on Monday, January 22nd. Welcome those who are joining us online as well. Our first item of business is to approve the minutes of the January 17th meeting. Assume you all got those in your email box. Yeah, probably. Would you, with it being a Monday, would you rather hold off and take a look at those? Is that an agreement? Okay, let's hold off on them. Are there requests for bill introductions? Oh, yes, Secretary Howard.
Thank you, Madam Chair. I have two requests for bill introductions today. The first is RS 2333 regarding mental, emotional, and behavioral health. Current statute lets DCF, gives us the authority to assess and treat most medical needs of pre-adjudicated youth when they enter temporary state custody if a parent can't be located or they refuse consent. This would expand that to clarify that to include mental health and behavioral health. Right now, it only covers physical health.
Okay, committee, are there any objections? Okay, without objection, the bill will be, the request will be made.
Thank you, Madam Chair. And the second one is RS 2332 regarding child in need of care child support payments. This legislation would change current law that requires us to open new child support cases for every child who comes into care and to attach the costs associated with foster care to those parents, and would allow us to only open those orders that are considered necessary or in the best interest of the child. The federal agency has been encouraging states to make this change related to child support and child welfare.
Okay, I guess I forgot to ask on the other one if there were any questions. Are there any questions for the Secretary? Any objection? Okay, without objection, the request will be made. Thank you.
Thank you.
So in committee today, we're going to have a couple of reports. We're going to hear from Secretary Howard, who is just up at the podium. But first, we're going to have Natalie Nelson give us a report from the Child Welfare Oversight Committee. So, thanks, Natalie.
All right. Good afternoon, committee. I'm Natalie Nelson, a KLRD staff facilitator for the Joint Committee on Child Welfare System Oversight. I have served in this role for 2 years now. The committee was established in 2021 and is made up of 7 House members, most of which are on this committee as well, and 6 Senate members. Pursuant to statute, the committee is directed to review a number of items related to the child welfare system, including data on child maltreatment, duties and responsibilities of state agencies that impact the child welfare system, grants and services available with respect to the child welfare system, reports from related groups, child welfare related groups, and reports on concerns received from various stakeholders. In 2023, the committee met 4 times, once in March, June, August, and October. Each meeting allowed a period of time where the members of the public could provide comments on their experiences with the child welfare system. Most of these individuals were current or former foster parents, adoptive parents, or service providers. I'm not going to go through what each stakeholder had expressed, but I will say that the sort of common themes expressed was frustration over a perceived lack of oversight of guardians ad litem, challenges in caring for foster youth with trauma, disabilities, and other high needs, and negative interactions with caseworkers and other case management provider staff. And I forgot to mention that you should have in your testimony the actual report that looks like this. It's got our cover page there. It's report to the 2024 Kansas Legislature. Let's see. Each meeting also included updates from various programs and services offered by DCF, an update on complaints received by the Kansas Division of the Child Advocate, updates from case management providers and family preservation providers regarding their caseloads, performance outcomes, worker recruitment and retention, and services and programs offered by those organizations. Some of the other presentations in 2023 included an overview of the findings of a study conducted on foster youth placement instability in Kansas, an update on the implementation of the state's first newborn safety device program in Ottawa, Kansas, an overview of Foster Adopt Connect's Community Cafe program, services offered by Foster Village Lawrence, who, if I recall correctly, provide sort of material items for new foster youth. Child welfare workforce issues in Kansas and across the United States, legislation related to child welfare that was considered in the 2023 session, an overview of fetal alcohol spectrum disorder, which is commonly seen throughout the child welfare system, an overview of Kids TLC, which is an organization providing an array of psychiatric and behavioral services for children, a presentation on representation of children in child in need of care proceedings, so whether that be an attorney, guardian ad litem, CASAs, that sort of thing. An overview of the sole family legal permanency option, which we'll hear about more about on Wednesday, I think. An update, and then an update on the Care Provider Network program that was codified in statute last session. I would note that the committee also recessed into executive session at the October meeting to discuss confidential information related to an alleged child in need of care. So that's sort of what the committee did over in 2023. So now I'm just going to go through the recommendations that were actually made at the October meeting. So after discussion, the committee agreed to the following recommendations: that the concept of the sole family legal permanency option should be supported and a bill regarding the topic should be introduced. A bill amending the fiduciary responsibilities of guardians ad litem should be explored by legislative staff, taking into consideration the contents of HB 2381 from the 2023 session. Legislative staff should review and report back to the committee regarding the rights of biological parents once a child in need of care petition has been filed. And then 2 members of the committee should develop a standardized rubric to be utilized by child welfare case management and family preservation providers in reporting outcomes to the committee. And then there was a recommendation that DCF report on a few different items at a future meeting. 1, what the state is doing regarding fetal alcohol spectrum disorder screenings currently, 2, how the needs of children in homeless encampments are being addressed. 3, what policies are in place among utility companies to avoid terminating utility services when children are present in the home. And 4, what grant funding is available in the state for nonprofit organizations to support children who support children with disabilities. And then finally, recommendation is that this committee should review HB 2299 regarding attachment in adoption from the 2023 legislative session. And that is all I have. I know that was brief, so if anyone has any questions, want any more detail, I am available.
Other questions for Natalie? Okay, seeing none. Thank you, Natalie. So the House and Senate trade-off chairmanship for that committee as an oversight committee. So I'll be chairing that this year and looking at a date probably in March, probably a Friday. We need to talk. Okay. Well, we were assigned to do something, and we haven't done it yet. So Representative Howerton and I are going to connect. Okay, next up, we have Secretary Howard, and to give us an overview of the foster care system for 2024, 23, 24. I don't know how you'd say that.
Thank you. Thank you, Madam Chair. Pleased to be here in front of the committee today to provide an update on child welfare and foster care. I'm excited to share some of the good things that are happening and share some of the things that have already happened and maybe some things coming up here in the coming weeks and months. I'll start my presentation as I usually do, just by doing a little bit of by the numbers. And so if you turn to page 4 of the testimony, in terms of talking about the number of youth who are in foster care, as of January 16th, just a few days ago, our number of youth in foster care had dropped below 5,900 to 5,895 youth. That's a reduction of about 22% since 2019. And that's the lowest need for foster care in Kansas since 2014. And as we work through the presentation, I'll kind of talk about as well, the things that sort of have contributed to some of those reductions, some of the prevention work, some of the changes in practice models and things like that. So in addition to the number of total children in foster care, it's also important to look at the number of children entering foster care across the years. So last year, we ended state fiscal year 23 with under 3,000 children entering care, 2,960. That was a 28% reduction since 2019. And as far as we can tell in looking back at data, that's the lowest number to enter care in at least 18 years. And as you can see the numbers in the current fiscal year, that 1,361, that's just through January 16th. You can see that trend is continuing in terms of reductions of youth in care. Again, that's just a little bit over half of a year. But if that were to carry out for the rest of the year, we would continue to see a decline again. Then the next chart on page 6 kind of compares entries and exits. So you can see the number of exits exceeding the entries, beginning in state fiscal year 20. So that's good news, and a lot of that has to do with the prevention work that's happened in the state, some of the changes in practice models. So it may seem counterintuitive when I show you the next slide, but as we look nationally, Kansas still has a much higher rate of entry into foster care than most states do. So even though we've made good progress in prevention services, in trying to serve children where they can be served safely and their families to do that, we still have a higher entry rate than the national average. And at least when this data was taken, we were 46th to 52nd. We might have improved some since then. And we'll talk about some of the reasons that this might be. But again, so much of the focus that I've had as secretary and we've had as an agency, and that I think the governor and legislature have supported us in, is really trying to have those sorts of services and supports available that mean that youth only come into care if they need to come into care to be safe. So again, lots of great progress, but yet we know that we still have some work to do. And so the next couple slides, I think, begin to help us dig into that a little bit and understand that a little bit. Children can come into foster care for reasons of abuse or neglect, and that would be kind of the blue part of the bar chart on the next page. Or under Kansas law, they can come into care for what's called a FINA. family in need of assessment. And just for those who may not be aware of everything that might include, a FINA can include categories such as issues related to the child's behavior, truancy, issues to do with substance use in the family, or a general category that has to do with a caregiver unable to cope or care for the child, which sometimes is connected back to the other categories, right? There can be more than one reason. If you have, for example, significant, say, behavioral issues or maybe behavioral health issues going on, mental health issues going on, that can mean that you have both a child behavior issue and a caregiver not able to care. But we know that of the FINAs, that about 29% of those relate to child behavior, about 34% caregiver unable to care, and 16% truancy. So we, in the last, this fiscal year to date and last fiscal year, about 61% of youth who came in related to abuse or neglect, and the rest related to FINA. It's also important to look at how children come into care. And remember, only law enforcement or the court can actually remove a child, but in terms of who makes that request for the child to come into care, if you look at page 9, DCF can make that request, or that can happen, through police protective custody in a direct order of the court. So as you look at the data on page 9, you can see, it's varied a little bit from year to year, but if you look at last fiscal year, 57% of those were requested by DCF, 43% directly through the court. And one of the reasons why I say that is because some of the initiatives that have been put into place that we'll talk about, like Family First, some of our team decision-making models, sometimes we've not had the chance to consider whether or not a prevention service for that family, intensive mental health services or parent skill building, is a possibility before a child has come into custody, when that happens directly through the court. So again, although you'll hear about some initiatives that we're taking in partnership with district attorneys and court systems to impact that and to be able to have those conversations and to consider those options. The last just basic data chart I'll share that we just always share has to do with the finalized adoptions. In state fiscal year 23, 880 youth were adopted. Average age of the child, the time of that finalized adoption was 8 years. Just under 59% were 8 years or younger. I think it's also important to know that almost 60% of the youth were adopted as part of a sibling group. And you can see the split. This usually varies a percent or two, but almost every child in custody has been adopted by either a relative or a foster parent, so where there is a connection for that child. And then about 2% is another adoptive resource. So in putting kind of in context some of the data that we just talked about, I wanted to talk about some of the prevention and community engagement activities that we've been about in Kansas. And that will start on page 12. First, the Family First program. Which began in October of 2019. Just as a reminder, this opportunity for states came out of the federal Families First Act. That allowed states for the first time to be able to draw down federal foster care funds to match state dollars to provide services before a child would come into custody. So to really be able to use that for prevention. And we were a state, as you'll recall, that jumped right in. We were one of the first 4 states. This legislature was very supportive in both funding and some legislation that we needed. So since that time period, a total of 5,000 referrals. On the right side of the page, you can see that about 45% of those were for mental health services, about 30% for parent skill building, a few more for what's called kinship navigation, which really helps relatives with various kinds of legal issues, and a bit around substance use services. And then for some of those youth, it was multiple service types. The categories of services were called out in the federal law, as were requirements that services be, have some evidence base to support those. So on page 13, you begin to see the outcomes that we've seen, and why the institution of Family First itself is one of the reasons that we've had fewer youth come into care. So 90% of target youth and children who've reached 12 months for the time of their referral to Family First have still remained together at home without the need for foster care. And then I'll highlight the last bullet on that page, that only 5% have been placed in foster care during an open case. So again, the vast, vast majority have stayed safely at home. So again, very effective program. It has very extensive evaluation through a partnership with KU. Again, that was also a requirement of the Federal Act to have that. And this year, the fiscal year that started in July, we were pleased, you can see on page 14, we were able to expand the program based on funding that that had been approved in 2022, as well as additional from our initial governor's enhancement, and then some additional legislative appropriations. So last spring, we rebid the program. We use a number of community-based providers across the state. We rebid the program, and we now have 15 programs through 12 providers. So beginning July 1, one of the things we were most excited about was the ability to have a substance use disorder service in each region. In our first round of Family First, for the first 4 years, we had very little in the way of substance use. I'd still like to see more, that we at least have a service available in each region. The DECA START program, DECA Sobriety Treatment and Recovery program, which has a supported rating on the Federal Clearinghouse for its evidence base, and the KBC Strengthening Families program. We also were able to expand the multisystemic therapy program statewide. That was also a big deal as you think about older youth and youth with behavioral problems and issues and challenges. That's a very, very effective program, also in the juvenile offender world. So again, we're very proud of the work that our partners are doing, and very grateful to have been a state that has been able to invest in this, but to have consistent outcomes for the first 3 years and that very small percentage of children removed. So again, as we think about some of the impact that's been had, certainly Family First has been a huge impact. You've also heard me talk in the last couple years about some other work that we've done to maybe even move a little bit more upstream, because, with Family First, that child is supposed to be at kind of imminent risk of going into foster care to be eligible for those services. But I really believe, and we really believe as an agency, that it's really important that we be engaged with communities in supporting families to get the needs and supports they need as early as possible. And you've heard me talk in the past about some collaborations we've done with some school districts that are still in place, where we've embedded, given them the opportunity to have kind of a specialized staff person who's kind of serving as like a resource connector for families who maybe in the past they might have made a report to DCF, but it wasn't necessarily a case of abuse. But in this case, they're then going further and really trying to find those community needs and resources. So building off of that, last year, DCF awarded $1.8 million to 10 entities to develop family resource centers in Kansas. We had 2 or 3, but not very many compared to other states. And family resource centers are really community-based or school-based hubs of support and services for families. When you look at the national outcomes for family resource centers, you see significantly lower rates of child abuse investigations. You see significant reductions of children in foster care in those areas, improvements in the children's education success. You see gains in the family self-sufficiency, and almost a $5 return on investment for every dollar invested. So we entered into grants with 10 entities. I'll show you those on the next page in just a minute. And the thing I would say about it is, you know, a family resource center, they can serve a community as small as a zip code. You know, one of the awardees in Sedgwick County, the Urban League, I mean, they're serving one specific zip code, and then you'll see others that are serving a number of counties. They also can target their services to be about whole family or maybe more specialized in early childhood, can do things, everything from job training to parent classes. But again, these are trusted organizations in the community. We're working with KCSL on this. They're helping the federal resource centers to gain national certification and really connecting those together. And we, this summer, awarded the University of Kansas a grant to evaluate the impact, because I think it's really important, just like with Family First, that we're able to show that impact. So I hope that next year when I'm here, I'll be able to give you some great numbers about that. So again, this is more upstream, but very important in terms of connecting families to the supports that they need. Page 16, you can kind of see that map in the kind of red stars in some of the various counties, show the counties where services are available. And then you can see the names of some of the organizations across the state. So we have everything. We have, for example, 2 school districts, Turner and Lyon County. We have KFAN, which you are familiar with from some of their testimony before the committee, in both Southeast and Southwest Kansas. We have KCSL in the Urban League in Wichita. And we have the prevention organization Live Well Kansas in Northwest Kansas that's serving a number of counties. And again, that just gives you an example. We have a small child care center in Douglas County and an organization called Pony Express up in Washington and Marshall County. So again, those are our family resource centers. The other thing I wanted to talk about, again, when we think about how we continue to make progress on ensuring that youth come into foster care for reasons of safety. Yeah. Yes.
Would this be a good time to pause for
Sure.
some questions?
Happy
I
to
was
do
trying to see if there was a break in there, and before you
that sounds
jump
great.
into the Iowa pilot
That
program.
sounds great.
Committee, do you have any questions on Families First or any of that data, Representative Humphreys?
Thank you. Thanks for the good information, and I know really good progress, so appreciate your work. But my question has to do with the slide that you showed about adoptions. And, you know, the average time in care was 41 months, which you didn't bring up. And my question is, 3 years and 5 months, average kids don't have permanency. They're in the care of the state, but they don't have permanency with a family. And so what is your plan to shorten that time period?
Yeah, it is too long. I mean, and you're right. And our issues not only with adoption, although adoption is an area where the ability to shorten some of those processes, I think, can be in our control. But overall, and I think this, Representative Humphreys, overall, children stay in care too long. They stay in care too long if they are on the adoption track. They stay in care too long if they're reintegrated. And actually, as part of the recent Child and Family Services review federally, sort of that whole issue of kind of permanency in child time, whether it's adoption or reintegration, is one of those areas of focus. And so we've been working on actually a corrective action plan in that regard that we actually need, that we'll share with our federal partners, that we've shared with our federal partners, kind of looking for approval on that. So I'd be happy to share some of the strategies with you around reintegration generally and adoption.
Legislative timeline requirements or anything that we can help?
I don't think so, Representative, but I will go back and talk with my team about that to see if there are some things legislatively that could help to expedite that.
Thank you. Thank you, Madam Chair.
Happy to do that.
Further questions? Representative Wagner.
Thank you, Madam Chairman. I know one of the things in this committee that we've heard before is, and you're talking about the data showing that Kansas still has sort of very high intake as far as kids into foster care. It's because Kansas will take kids in just for the reason of neglect, or that that there was something, there's something unusual that we do that other states don't do. Can you elaborate on that, if that rings a bell?
Yeah, the category of FINA, the Family in Need of Assessment, which is where there isn't abuse or neglect, is a category. I mean, it looks different across the country. Every state's child welfare system is every state's child welfare system, but in a number of states, there are either maybe extra steps that have to happen before a child would come into custody if it's a reason for non-abuse or neglect, or it's not allowed at all. So certainly the FINA issue is an important facet of it. In terms of those youth who come into care, it's always that sort of thing where, a child shouldn't have to come into custody to get their mental health needs met. And frankly, coming into custody doesn't necessarily help them get their mental health needs met. So I do think that's a bit why we've been putting some emphasis on the piece I'm going to talk about next, Representative Wagner, kind of some of the work that Iowa has done. A number of states have made changes in their statutes, either around FINA or around the definition of neglect. Texas recently made some changes in their definition of neglect that narrowed that. And then a state like Iowa that had a pilot project go on with their judiciary that then led to statutory changes in terms of the kinds of findings a judge would have to make to really find that the risk of the child remaining at home was greater than the risk of harm of actually coming into custody, because there is harm from coming into custody. So, yeah.
Of course, I really appreciate this. Looks like a very good report. Just on page 5 and 6, where it has the number of kids entering and exiting, it's just a 20. You really have to look at the final number, because it looks like things dropped dramatically in 24, when actually that's just a partial year data point. And so, the actual data for state fiscal year 2024 is clearly going to be up 2,600 if you annualize it. If there's, that really threw me the first time I saw it. It sort of is slightly misleading. If there was a different way to present it, would be helpful, I think.
I appreciate that, Representative. It kind of throws me too each time. I kind of wanted to let folks see what the trend is this year, but when I talked about kind of the lowest number entering, I was really talking about the 2,960 number for all of last fiscal year. So, perhaps we should have just had a bullet that says trends so far this year would suggest. Yeah. I appreciate that. Thank you.
Representative Howerton.
Thank you, Madam Chair. Just to follow up with Representative Humphrey's question, what is the average, nationally, for adoptions? Do you know that, or maybe it's something research could?
I don't know that off the top of my head. We can try to bring something back to you, though.
Thank you.
Yeah.
Further questions? Okay.
Madam Chair,
Oh, is that Representative Neighbor?
neighbor, my hand is
Yes.
raised.
Okay, sorry.
That's all right. I'm a little ways away from you. I just want to thank the secretary for the information today. It's so much better than it has been, and it looks like the programs that are out there now, some of the new ones, and some of our regular ones are enhanced and seem to be doing a good job. My one question was, as far as an adoption is concerned, this is going back to Representative Humphreys, is there a timeline in the courts for an adoption from start to finish? And is it more because there's the court time, the lawyers and all of that, or is it information going from your department to that department? What makes that 41 months?
And it can be thank you for the question, Representative, and that can be a combination of different things. It could be, there certainly are requirements in terms of making that decision that adoption will be the case plan, so I think there can be delays on the part of case management staff in terms of that process. There can be delays in terms of identification of the adoptive resource. And then obviously there can be delays that just have to do with the legal process and the provisions related to that. And DCF has done some different things over the years. I know when I first came into this role, DCF had put into place kind of adoption accelerators where there were actually some staff in each of our offices who were really just trying to make some of the paperwork go faster and take that burden off of case managers and things like that. So there are different tools, certainly, but that larger context of how long kids stay in care, that's what I alluded to, that we're working on some strategies now that we'd be happy to share with this committee that relate to kind of the recent the Federal Children and Family Services Review that told us what we already know, that kids stay in care too long, whether they're adopted or reunified. So,
thank you for all your hard work. Thank you, Madam Chair.
Representative Ousley.
Thank you, Madam Chair, and thank you, Secretary, for being here for the update. And I apologize, I had to step out, got a vehicle in the mechanics, and I had to find out how bad the news was. But you answered part of my question when I walked back in on slide 14. You said there are currently 15 programs through 12 providers with the Family First, and I guess kind of going into the Iowa model and to what Representative Wagner was talking about, how Kansas removes. Over the interim, we had the opportunity, the chairwoman and I, to sit down with the Casey Foundation on a child welfare summit and talk to folks from different states, near and abroad. And it was brought up that Texas had quit removing children except for in emergency situations. And it was more recently added that Texas also has more support programs available for those children that wouldn't come into custody. And I guess my question would be is, if we have 15 programs now, are we expecting more? Are there several more, waiting for the federal approval? Because I know they had to be,
yeah, they had to be on the clearinghouse, Representative. I mean, to get the federal match. Now, what I would say is, you as a legislature have been very generous, and so has the governor, in the sense that when we were an early adopter, we funded some programs that weren't on the clearinghouse because there wasn't much on the clearinghouse. Well, because we're measuring all of those programs, we have continued to fund some of those with state dollars, even if they weren't on the clearinghouse, so long as they were meeting these targets. So we're not waiting on like federal approval for anything. I mean, we would love to get federal approval for some programs we're already doing so that we could draw down that match and the dollars could go further. But no, I think we're not waiting on the federal government for anything there. I think that, like anything around prevention, is just really more a matter of kind of the level of resourcing that we invest into it as a state. So, yeah.
to you more about that offline, because obviously the more federal resources we can draw down, the better off all of our
Sure,
kids in the state
sure.
are going to be. So, thank you. Thank you, Madam Chair.
Any other questions? Okay, let's keep going.
All right, I'm going to move to the Iowa. I think it fits very well with the conversation we've been having. Just as a reminder, I think most of you have heard this, but I want to give you an update on where we're at with this. A few years ago in Iowa, there were 7 judges who started a pilot project in their jurisdictions where they began asking in the courts 4 questions before deciding to remove a child from their home. And you can see those questions on page 17. Those questions, what can we do to remove the danger instead of the child? Can someone the child or family knows move into the home to remove the danger? Can the caregiver or child go live with a relative or family friend? Could the child move temporarily to live with a relative or family friend? Well, what happened in those jurisdictions that implemented this pilot is they saw a 50% reduction of children coming into care during that pilot project period, and a greater initial placement with families and relatives. That's kind of how the project started in Iowa. Now, subsequently, Iowa then went back statutorily and has made some changes to their statute. 2 changes. One, to require that the judge seek the least restrictive care for the child with a preference for placement with the child's family or other kin-like persons. And then the second one, a legislative change that required, in order to have a removal, the court has to find by substantial evidence that the need for removal outweighs the potential harm removal would cause the child. So, and that's actually in their statute like 3 times. That's how much they were stressing that as they made their statutory changes. So in Kansas, as you know, we began looking at some of the work they'd done in Iowa, and there was a number of activities happen. Some CLE that our regional director in Kansas City helped to initiate. So a CLE opportunity for some of the legal folks in our state. And then we just kind of started using these questions ourselves within DCF. We have a process, before a child would come into custody, we call team decision making, get everybody around the table, the family, those who care about that child, et cetera. And we began using these questions. Recently, in the last few weeks, we were able to get a little bit of resource from the KU School of Social Welfare. They got some supplemental grant funding for a federal grant they have that's focused on supporting relatives and family members. And they gave us $48,000 for our regions to continue some of the conversations and work on this. And I just wanted to give you a couple of examples on pages 19 and 20 where you can see some of the progress. So for example, in our West region, courts and county attorneys are now asking if the 4 questions were considered in the decision, even of DCF, to request the placement of the child. Courts have begun to use some of that very language. And then also in those instances when I talked earlier about, those youth who were coming into custody without DCF engagement, in many instances now, courts are allowing DCF some time from the point that the child comes into the police protective custody to set up that team decision making, to do some of that upfront work, to see if a family first referral would be appropriate and things like that. And you can see, I'll just use one data point here. In Salina, 89% of their home recommendations ended up including no court involvement. Another example in Northeast Kansas, that we are staffing those police protective custody cases now and meet monthly with court services. So, I mean, I think that my point in all that is to say that the collaboration and efforts across the system now with DAs, with courts, has significantly increased. And the 4 questions has really, I think, been an avenue for everyone to think differently. Another example that's a little bit different in Southeast Kansas. In Southeast Kansas, our staff have put a lot of focus into trying to make sure that there's an understanding of what community resources are available and that all the community partner agencies understand that. So they now have virtual monthly meetings between all the different kinds of entities that might go into homes or schools or in the community to work alongside families. And they kind of have a continuous virtual chat for the effort to identify resources that can help a family. So, and this is called the Agencies Working Together Initiative. And again, it just oftentimes helps to uncover a resource that might be there that one might not know about. So again, just one more example of some of those sorts of things going on. So, but I wanted to give you an update on the Iowa work, especially just some of the progress that I think we're seeing in those collaborations with the courts and the DAs, and really having that opportunity to think about what's best in terms of child safety and whether needs can be, whether a child needs to come into care for safety needs, or whether those needs can be met in a different way. So. I have a few other foster care related updates. The first 2 on page 22 and 23 will be RFP updates. So I can't say very much today, although I'll be able to say much more very soon. As you all know, I think you know, this was the year where we were bidding out our foster care case management provider contract. We are in the final stages of that process. What I can tell you today is that we had 5 bidders. You can see those on page 22. The first 4 are existing case management providers. Ember Hope was a new entity that submitted a bid. As I said, we are in the final stages. I would hope by early February that we would be able to announce those and talk with you more about that. So we're excited about that. And then the other RFP that I know this committee also has interest in is related to the Child Welfare Information System. There's several RFPs related to an IT project, but the significant one for our purposes today is what's called the Design, Development, and Implementation RFP. We had 11 bidders for the CWIS project. We have narrowed those bidders. We are in the process of completing program demonstrations. And again, we expect to award that contract in March. So again, we'll be able to come back and give you more details about that yet during the session. I would note that the governor did include in her budget $17 million, about $8.5 million SGF. It's funded 50-50. Federal and state, and anticipating that would be over a 4-year period. So again, we're excited to be at this stage. As you'll recall, this would replace 5 existing legacy systems and also have our case management providers connected to CWIS as well as others. So very, very significant to be at this stage. So stay posted on those 2, and I'll be able to give you more information on those. Another initiative that we're very excited about that's also a collaboration with the courts is something that Chief Justice Lukert talked about in her State of the Judiciary message. She reached out to indicate that they were interested in starting family treatment courts. You know, the court system in Kansas, they've had a lot of success with a number of specialty courts, whether those are mental health courts, substance use courts, even a couple of veterans courts in Kansas. So they were very interested in family treatment courts. So I've had DCF and KDAD's team members on a work group with the judiciary. And this would be around family-centered court court dockets for cases of child maltreatment in which parental substance use is a contributing factor. So the court system will be piloting this starting in September in Cowley, Lyon, and Miami counties. And the governor's budget actually includes about $1.5 million in the KDAD's budget for the substance use treatment costs associated with that. So we're very excited about that. Once those jurisdictions are identified, we're going to work with the courts to identify specific outcomes to measure. And it would be the sorts of things like, diversion from care, length of time in care, those sorts of things. So we'll have some real metrics to share. So we're very excited about that, and also excited about the upcoming Child Welfare Summit in April that I think many of you will probably have been invited to, with that collaboration between the judiciary, the legislative branch, and the administrative branch. And some of the things we talked about already today in terms of summit topics, the reference to permanency on page 25, that really is really related back to Representative Humphrey's point about the length of time in care, whatever the case plan goal is. So again, the exciting thing to me about the Child Welfare Summit is it's 2 days, but it's not just 2 days. I mean, the way it's structured is that there will really be local teams who then will continue to do work in their jurisdictions, because every piece of data, every factor, it can look different in different parts of the state and in different jurisdictions. So again, April 15th and 16th, I'm very excited about that. A few legislative updates. From things that you passed or resourced for us last year. Therapeutic foster care. As you know, we introduced therapeutic family foster homes as a category of service and with a specific rate in July of 2022 to provide 24-hour care for children and youth with high acuity needs. And this was really one of our goals around placement stability, in trying to have those high needs youth, having more stable placements. Last year, you provided $6 million in additional resources for us to be able to grow that program. I think, in our early efforts, our first goal was 25 homes. We got to about 15, but you provided $6 million to expand the therapeutic foster care program. On page 28, you can see that about half of that funding is being used specifically for capacity building grants, and we have an open bid that is also closing for just innovative programs to develop that across the state, and then also we use some of that funding to be able to target prevention of foster care through some therapeutic home rates, and then some of the things that have been shared as well during the last session related to what does training look like to really support those families, as well as some statewide recruitment. So that's well underway. We're really excited about what that can mean for the capacity of that program. The next page is juvenile crisis intervention centers. This is really will be a treatment service resource for up to 30 days for any youth experiencing a behavioral health crisis. This could be youth in custody or not in custody. You passed legislation to allow this a number of years ago. Regulations just really didn't get adopted, and an RFP kind of busted up a few years ago. It just didn't really happen. So I'm really pleased to tell you today that the licensing regulations are to the stage of going to the Joint Committee on Rules and Regs, and then to the public hearing in March. This was an arena where we were also There had also been a recommendation that we be able to access funding from juvenile services through the Evidence-Based Programs Fund. So we've executed that memorandum of agreement for $2 million in funds. So we will enter into provider agreements with willing providers to operate a JCIC. We'll set a daily rate of payment for youth in custody. And then the $2 million in funds will really be associated with issues around startup or other related operating costs that fall outside of the daily DCF rate or for youth not in our custody. So this will operate a lot like some of the crisis stabilization services in mental health, where at KDADS, we enter into grants with local mental health centers for their crisis stabilization centers. So this has been a long time coming. We think both Johnson and Sedgwick County have interest in doing this. So again, more to come on that, but I'm really glad to have sort of gotten through the regulatory, very close to being through the regulatory side of this and being able to move forward. Page 30. The legislature last year also appropriated $1 million targeted towards prevention of children with IDD coming into custody. This would be another example of those situations where, coming into custody to get services or, those sorts of things. And so we held a series of stakeholder meetings with providers and community agencies and families with lived experience with those young people with very high needs. And so we've made an agreement with Families Together, which is, it's been around for many years. They provide family support, they provide resource connections, they support families with youth with intellectual and developmental disabilities. So again, services are accessible statewide, and they can be in the home based on the family's needs and the provider availability. So we think that's going to have a real impact in not having youth come into, with IDD come into custody when you don't have a safety issue. One more thing related to last year's budget. $2 million was provided to support the evidence-based functional family therapy so the governor signed into law the $2 million. We completed awards with the same 3 agencies that provide FFT for the Kansas Department of Corrections, Ember Hope, Cornerstones of Care, and Eckerd Connects. So again, we're using the same providers and the same service catchment areas as DOC does for youth and juvenile services. Cornerstones of Care is fully staffed. They are currently providing services to 8 families. Eckerd and Ember Hope are in the process of expanding and staffing up their services. Again, a very effective program. Glad to have that available for youth in the child welfare system. Almost done here, so you all can have a chance for questions. Related, House Bill 2021 that passed last year that had a number of provisions that impacted the Department of Corrections juvenile services, but also had some pieces that related to DCF. Essentially, one of the things that bill did was to establish certain criteria by which youth in foster care could be referred for some of the services that those local juvenile offender boards provide. So we had to identify an assessment tool to identify those children where the referral would be appropriate. And you can see under the CAFAS and the subscale associated with that, probably the most important bullet has to do with the youth identified as exhibiting behavior that could lead to juvenile offender charges, et cetera, et cetera. And so, again, really excited about that. All of our case management providers have been made aware of what those various programs are, and we're really encouraging them to work together locally with their local JCAB boards in terms of what the most appropriate services are in each instance. This really lets us start to think about kids as kids and not necessarily by the label of whether they ended up in the child welfare system or the juvenile offender system. And again, this is really targeted for those youth who meet those kind of offending kinds of behaviors. In terms of our legislative agenda this year, we have one bill remaining from last year that had to do with foster youth bank accounts in terms of allowing youth 16 and older to be able to open bank accounts. That passed the House, is current in the Senate Financial Institutions Committee. And then a few DCF proposals. The first two were the ones I asked for introduction today. Then we also will have a couple of additional ones. One relating to the release of information that would increase the circumstances in which DCF could at least provide basic information about whether or not we've had contact with a family. So in an instance where criminal charges have been filed against someone related to the death of a child, under this bill, we would be able to provide that basic information about what contact we've had with that family, even if we as an agency haven't been able to go in and confirm abuse or neglect. And then what we're calling the Public Assistance Accessibility Package, we're really looking at trying to modify some of the existing laws related to public assistance that would allow families to begin to receive benefits again once the adult comes to compliance with provisions that they were in non-compliance with. Right now, there are kind of some time frames that the family has to wait. This would allow them to access those services once they come into compliance. And then the last thing you'll get to hear about on Wednesday is SOUL, which we're very excited about as an agency and very excited to see this youth-led initiative go forward in terms of a new legal permanency option for youth. So I won't say anything more about that. I won't spoil your Wednesday because you'll get to hear all that from the young people and the advocates themselves that day. Happy to answer any questions.
Okay, thank you. That was a lot. Do we have any other questions? Representative Carr.
Thank you, Madam Chair. I do have one question with respect to my battery, unfortunately, went out on my computer, but I think it was JCIC. That program, as it opens up, is that going to be a new facility, or are those bids, I'm assuming, is what that would be, that bidding process, would that be existing facilities that are expanding what they're doing as far as services, or how does that look?
Sure. Yeah. Thank you, Representative. That's a great question. It could be either. I mean, I think, for example, I know like in Johnson County, I mean, they've had a lot of discussion between their mental health center and their juvenile corrections entity. And so I think they're looking at this as a new service model. But they already have, for example, the physical space to do that in. So it could be a lot of different things. Someone could modify services they're already doing if they wanted to be a JCIC, or it could be a new service category.
As a follow-up, I know specifically in Sedgwick County, certainly Wichita, that block, if you will, of youth that would require those kinds of services, it's been problematic because we don't have anywhere to put them, so to speak. So how would how am I going to frame this? So how do we make this information publicly available so that we can have those entities that might be interested in creating said program become involved?
Yeah, thank you. So that's a great question. I mean, the first step in which I think the public awareness will really happen is we have to, as a part of finalizing the regulations, we have to have a 60-day public comment period. So, as those regulations are published, certainly that we will be making folks aware that those are out there. But more importantly, once the regulations are finalized, we will develop like, a template for people to apply for grants or things like that. And then we'll reach out to, the various service sectors, and probably also use some of our, existing partner organizations to make that known across each community. So.
Thank you.
Representative Howerton.
Thank you, Madam Chair. I'd just like to ask the Secretary for an update on the birth certificates. We had legislation last year, and you were working on an agreement, and I had an issue over the summer with that, so I just wanted to follow up with you.
Oh, thank you. We should have included that here. We have entered into 2 memorandums of understanding with the Department of Health and Environment to expedite that process, or maybe one, combined one. We kind of did it in 2 parts. That's kind of why I say 2. The first thing that we did had to do with kind of those unique circumstances where you just can't figure out the evidence as to like where the child was born. And there was one particular circumstance in the child welfare system that went on for a long, long time. So we reached some agreement with Health and Environment about those circumstances and what kind of an affidavit we as an agency could do, based on the evidence that's there. And so we feel good about that. On the more broader issue, we also reached an agreement whereby KDHE will have dedicated staff to support the birth certificates related to youth in the foster care system. We've just recently getting out instructions to our case management providers about how to access that, and then clarity as well related to the documentation that's needed. So I'm eager to see how that works and to measure that, and I'm eager to see if we continue to hear issues or if we've solved it with these MOUs. No, so.
I'm eager as well. Thank you.
Representative Wagoner.
Thank you, Madam Chairman. I did want to jump back up to on page 7 on, the rate of entry into foster care as far as the national average is 2.37, Kansas is 4.36. I mean, granted that our overall rate is dropping, but I would presume that with Family First, that probably that's a national trend that all across, that they're dropping. And so I still don't quite get, do you consider that a problem that Kansas is so anomalous? I mean, why would our kids go into foster care so much more than other kids? And, I don't know. It does strike me really odd the more I think about it.
We do. I think that's why I wanted to talk today and kind of stress some of the issues around kind of the definitions in our statute related to FINAs. Some of the recent trends in states to really narrow the criteria by which youth would come into custody. And I think certainly there are a number of states who, before Families First, had a broader array of preventative programs than we had in Kansas. We had really had family preservation, and that was about it. But that's not the only answer, right? There's a lot of facets that fit together into that. But I do think the combination of the criteria that are used and the availability of other alternatives, which is why we're so excited to see the numbers drop, but I just wanted to put it in a context to say we're still out of kilter, nationally with those numbers. So,
just one of the kind of side question. I know it does come up, or at least I know it's come up in this committee in years gone by. But I know it's still an issue where, as far as foster kids, staying in like the offices of the, whatever agencies rather than having a place. Is that getting any better? Is that solved? What's our status?
I wouldn't say it's solved. I would definitely say it's getting better. You might recall we talked to you last year about one initiative we put in place. It's just one where we'd created a standby bed network, kind of like bed holds, like at hospital, like at nursing homes if somebody goes to a hospital. But we basically had homes who would agree to take a child at any point in time. That's been very successful. In some cases, those have turned into placement placements. We were just talking today about a youth who had been, quote, in the standby bed for 266 days. Well, guess what? They were in the same standby bed that became a permanent placement. That was a youth who had a lot of instability before that. So that has been very successful. We've seen a 60% drop since we did that. We still have some instances where we'll have a youth in an office, but like for example, this month we haven't had any so far. It doesn't mean we won't tomorrow, and it could be something as simple as you couldn't drive on the ice, or it could be what we tend to see more often is, particularly with older youth, those youth really, kind of refusing a placement, and how you help that to happen with those youth, how you really listen to what they need and what they want, and sometimes it's that, or maybe a placement says they can't have their phone and they're not going to leave without their phone, or whatever that is. It could be a lot of different facets, but we definitely see improvement. Significant improvement, but I would not say that it is 100% solved. So
I think I want to follow up from those questions. We had the joint hearing last year of the door being too wide open, and sometimes I need to have kind of an anecdotal, I don't always like the anecdotal stories, but sometimes I need to have those to understand. I had a bio mom call me a couple of months ago, and she was upset about her daughter in foster care, and her concerns were valid, but they're not important to what I'm going to ask. But I asked the question, why did she go into care? And she said because she was out of control, that she couldn't handle her, and there was no abuse or neglect. She couldn't handle her child. And so she got put into foster care. So is that the situation that we're looking for these therapeutic foster homes?
And that could, in some circumstances, that could be. And if you noted on the therapeutic foster care slide, with the pie chart, we're using a little bit of that funding for what we would call prevention homes, like before a child would come into custody, a therapeutic placement where they could go. Maybe there just needs to be a break for a little bit. Maybe there needs to be, as one's figuring out what kinds of services does that family really need. Might functional family therapy help that? But maybe there just needs to be just a little bit of letting off the steam for a little bit in a place for that youth to go. So therapeutic foster care could be one thing. Some of the things happening as well within the mental health system, where there are some juvenile crisis centers being established in a couple jurisdictions, those sorts of things that might give a chance, again, for those sort of respite kind of breaks on the mental health side, that would also provide some, treatment for that youth to see whether or not they needed more extensive placements, things like that. So,
what about a child that continually runs away, and then they are no abuse or neglect, but or that we know of, but they're put into foster care,
where they continue to run. So.
Yeah. So, are there options there? What are you looking at for options there?
I think every situation is just so unique. I do think that the JCICs might be an option in some circumstances in that kind of situation, without the child coming into custody. It's really it's really having to get at what's underneath what's leading that child to run, and I just don't know that them coming into foster care is the way to necessarily do that, which is why I say I think it's important to have respite, some other places that child might go on a short-term basis. But I think it really has to be about what kinds of services do we wrap around that child in that home, and that involves the mental health system. It involves some of the kinds of services we've talked about here today that sometimes have been very, very effective with that population. So.
According to our own laws, we are not allowed to lock them up for their own safety?
We have a secure care statute with some particular requirements around that. Now, I would be remiss to say that I am very supportive of secure care. I mean, many of the studies related to that would suggest that it does more harm than good. So, I mean, again, there's different views on that. And we have one secure care facility in the state. So,
Is that Wichita?
Junction City. I was going to say Gary, and I was going to say Manhattan, and I knew it wasn't that. Yeah, Junction
Okay.
City. So, yeah.
Okay.
Yeah.
All right. Are there other questions?
Right.
Okay.
Thank you.
We're off the hook. Thank you. Thanks for being here today. Okay, that's all we have on the agenda today. Committee, we, as mentioned before, we have the hearing on the Soul Bill on Wednesday, and we're having a presentation. What are we having? What are we having on Wednesday? Don't we have it? Oh, yeah, the child advocate will be here with her annual report. So with that, we're adjourned. Read your minutes.